Our presenter for the 10:20 time slot is Brianna Driver. She is from Cardington, Ohio, and will be sharing with us her Capstone project, Art Therapy Studio for Creative Expression. Please join us in welcoming her.
All right. Okay. Well, hello everyone. My name is Brianna Driver, and today I'm going to be sharing with you my project of an art therapy studio. So to start, why I chose this project, when I was kind of coming up with ideas for a particular capstone project, I was struggling to find one that I would truly be motivated to do through the entire time and that I was like really excited about. But then I talked to my sister-in-law who is studying art therapy currently, and she explained to me how there is a need for art therapy studios, and she had noticed that there wasn't a lot in the area. Another big reason that I wanted to address this project was that throughout my research, I found that anyone could be an artist, and I believe that that's really something that as children we naturally just create art without fear of judgment and without any holding back. And I really think that art therapy helps that idea as later in adulthood to come back to that. So for my brief of this project, I came up with the idea to design the interior of an art therapy studio for art therapists to help outpatients and the surrounding community have access to art therapy services. And through this project, I will be showing you my research and kind of explaining what art therapy is, and then I'll be showing you the programming of coming up with the spaces and the dimensions for that, and then I'll give you a look into the schematic design of the functional floor plan, the bubble diagram, and then go on to the design development, which will show you the renders and my interior modeling of that, and then finally the conclusion. So to start, what is art therapy? According to the American Art Therapy Association, their definition of it is art therapy is the use of art creation as a form of psychotherapy for people experiencing trauma or illness, seeking personal development, or struggling to deal with the day-to-day act of living. So in short, art therapy is a way of using art as a form of therapy and helping people express their emotions through a particular trauma or event. Now, I want to show you kind of what a session looks like. This looks different from depending on what art therapist is giving a session, but typically you have a one-on-one session or group sessions. For one-on-one sessions, it could look like something like a conversation between a client and an art therapist about what's on their mind or what they're struggling with, and that could go into the therapist giving them guidance or prompts on how to use a material or how they could express that emotion. And then the client could reflect on the thoughts and feelings from that piece of artwork they created and kind of explain what they're going through when they were creating that. In group sessions, this depends entirely on the goal or type of group, but an example of a group session could be an open studio format where they get to pick their materials and pick what they create, and this is the most freedom for what a group session could look like. Or it could be more structured where, like in one-on-one, a therapist could give a prompt, or it is some sort of typical, or it will be a specific group and what they are trying to accomplish. And so now I want to show you kind of the difference between a regular art studio and an art therapy studio, because they sound very similar, but they are a little different. So first, in studio art, you're expected to use a set of skills that are taught to you and you follow a certain objective, while in art therapy, art is the media for psychological change. So it's not necessarily you building a skill, it's just a way for you to express a certain emotion. And also in studio art, the primary goal is to create a finished piece of artwork, while in art therapy, the artwork does not have to be aesthetically pleasing, finished, or valuable. And also in a regular studio, your artwork is judged aesthetically, whether this be on your own, by peers, or your teacher. It's something that is critiqued. It also can be critiqued. while in art therapy, it's very personal, confidential, and it's something that's kept as a record of emotions and your emotional state. And the similarities I found between these two were also that you can use many different art materials, and obviously creativity is involved in both areas. So places that art therapy is typically practiced, there's a long list that I found, but these are just some of the ones that I wanted to address. So can be practiced in medical field and as well as schools. And what this looks like is in the medical, you have a art therapist will come and help people figure out what they're going through, if they have a particular illness, or if they're diagnosed recently with something, or how they're feeling about a specific treatment or anything like that. Art therapy is also used in schools. This can help children express how they are feeling in going through stress of school, or it can also be used in specific schools such as like special needs schools, and it can help those types of students kind of communicate what they're feeling. And art therapy can also be used in correctional facilities and nursing homes, and this just helps those types of people who are leaving a normal life and going into a totally new environment and kind of art therapy can help figure out what that experience is like and how they're feeling. And then finally, one of the big places art therapy is practiced is private practice and studios. And this can look like a art therapist doing in-home sessions, or going to hospitals and helping, but they have many different clients and help them. Or they can open up their own studio to have a place to have group studios or those one-on-one sessions that I was talking about earlier. So why is a space needed? In order for me to further understand this, I conducted several interviews with different art therapists here in Ohio. The first one being my sister-in-law that I talked about earlier, Shelby. She is a student, but she was the one that kind of brought the problem to my attention. She explained that there is a limitation in using multi-use spaces. And what this means is that all the places I showed you where art therapists practice are usually in multi-purpose areas, so it's not specifically designed for art therapies, but comes with some challenges. And then with that, there's just a lack of specific art therapy studios. And then I talked to Audrey Hook, who is an art therapist in Columbus. She is a private practice art therapist, and she helps children in-home sessions where she goes to their house, or she goes to nationwide and helps children there. And some of the challenges she brought to me was that there can be interruption during these types of sessions, because if you're at a home or a hospital, you can imagine there will be interruptions such as your parents or siblings, or in a medical setting, it'd be nurses or other patients, and that can sometimes disrupt the flow of a session. And then she also brought to my attention the challenge of storage of artwork and materials. And I asked her to explain this further. And she had said that how she stores her materials, because she travels back and forth, is actually in her basement. And she just has shelves and totes everywhere of all these art materials. But she also explained to me that if a client does not want to keep a specific piece of artwork, because it is might be too intense, or they didn't expect to create something like that, she, as an art therapist, is obligated to keep that for actually up to 7 years, because it is part of their personal record. So as you can imagine, that can accumulate quite quickly. Even though they encourage clients to take the artwork or to take pictures, they still sometimes will keep that physical piece. And then she also explained how working in cleanup space can be challenging, because if you're in someone's home or in a hospital, it's not created for having paint everywhere and clay everywhere. So sometimes you have to be wary of dripping on the carpet or getting all over the table or whatever that may be. And then the final interview I want to share with you is from a woman named Cheryl Pete. She is a clinical director in Cleveland, and she explained that some of the challenges she faces is that their studio is actually located in a multi-use space. So with that, the space is small. They can have a group of up to 6 to 8 people, but they can't have multiple groups, and they can't really have more than that. That's really all they can have. And then also they don't really have enough storage for the space that they're in. So from all my research through the interviews and other articles and things, I knew that I wanted my space to include lots of storage, lots of lighting, and lots of space. And if I further found what I wanted through the ethical issues in art therapy, which gives a list of proper ventilation, adequate lighting, access to water, knowledge of hazards, storage for artwork, allowance for privacy, and compliance with health and safety requirements. So this is really what I wanted to include in my design going further. And I also felt it important to really create a space where anyone can feel like an artist, so that they had a very comfortable space that they felt they could create without hesitation. So in order to make this project more realistic, I chose a site to match my brief, which was to help outpatients and surrounding community. I chose this because I knew I wanted a space that could be close to a hospital where art therapists could work in the hospital, but also in the studio, because as a private practice art therapist, they help multiple clients. So I wanted it to be near a hospital. And this example is near Riverside Hospital, near the Kobacker House and McDonald Heart Health Center. The area I would be placing my building is right in that area shown. And now moving on to the design, I started with an architectural program to get an idea for what spaces I wanted to include and how big the building was going to be overall. And then I placed those buildings into a bubble diagram. I created many, but this is the one that I felt truly expressed the flow of the building, and I separated the rooms into private and public areas just to better get an idea of what clients and what the staff, where they would be interacting. I then placed the rooms into a functional floor plan. This helped me better understand the flow of the space and how and where the clients and staff would be, and also the public. So you can see I separated that into the blue being the client spaces, which is mostly the studios, which I'll be going more in detail later, and then the public areas being in yellow and green being the staff areas. So once I got a functional floor plan, I went into concept development just to get a better idea for what I wanted my building to be and something that would help guide my building along. With that idea of anyone can be an artist, that kind of drove most of my concepts. So I came up with words like artistic mindfulness, protection, place of safety, and these are kind of the sketches that went along with that. And then I came up with words like retreat, place of growth, improving mental, physical, and emotional wellness. And through all of this, I decided, and through many more words and sketches, I came up with the concept of a balance of improving mental, physical, and emotional wellness, because I really felt that this kind of defined what art therapy was and could be applied to my building. After that, I created even more sketches going along with this concept, and you can see it was a lot of the idea of balancing rooms around a central area and just having those separate spaces of the studios being mental, physical, and emotional, and having that all come together. So here is that overall shape and the floor plan, and I'm going to give you kind of a tour of what this is before going into those interior renders. So you start in the lobby, and you see that there's a greenhouse in the middle, and that's just kind of the central focus of the building. And then you go to your right and you have the offices as well as the bathrooms and waiting room. And then you have one of the larger studios, which is the craft studio, followed by some smaller one-on-one studios. And then going up, you have your ceramic studio, material storage, painting studio, and finally end with the gallery. Once I got that conceptual floor plan, I placed it on the site plan, or on the site, to understand where the main entrance would be and how it interacted with the environment as a whole, and just to figure out parking and all of that. So that's what that looks like. I then created some elevations just to get an idea for what the building would look like as a whole and for scale. And now, once I created that shell, I just started to move on into the interior, and I started by creating a mood board. To get a feeling for what I wanted the building to be. When choosing the mood for this building, I knew I wanted it to be very earthy and organic, and I wanted the colors I chose to really be like calming and earthy in that way. And then here's like a closer look at the specific materials I chose for my building. When I was researching materials, I really was looking into how they affect people mentally and as well as colors. So there's a lot of greens and blues because those are very calming colors for people. And so in the lobby, you'll see I have also that natural wood on the floor there, and then that greenhouse in the back is represented by the plant I used in there, and then the waiting areas that more of those natural earthy materials. And then finally the studio materials I kept pretty simple because I knew they were going to be a place of art creation, so it was going to get rather messy. So for this reason, the flooring in those spaces is concrete so that you wouldn't have to worry about cleaning the wood or anything like that. So now moving into the interior spaces, giving you a closer look, I'm going to start with the lobby. During this ideation, I kind of already knew what I was going to be creating. I had an idea in my head, it was pretty quick, and then I quickly moved on into Revit to render these spaces. And so you can see that you are immediately greeted by a receptionist desk when you come in the front entrance, and you have that greenhouse behind you, and you have a view into the gallery space and the office space as well. So now moving on into the gallery space. The reason I included this was when I talked to therapists and asked them about displaying artwork and what that looked like, because it was a confidential thing, I got mixed messages on whether to do it or not, but finally, I decided to do it because I talked to one therapist who said if the client feels confident enough and comfortable enough to share their work, they should have a space where they can display it. So I designed a gallery so they could have a space to display this work, and people and visitors could see it whenever they wanted. So the ideation was really quick for this because I knew I wanted it to have the matching floor of the lobby and just be a place that could display the artwork. So this is what that design looks like, and it's just very simple walls and has a place for seating so that you can appreciate the artwork and take a look at it. And now moving on to what the waiting area looks like. I created the waiting area separate from the lobby because as I was interviewing Audrey, she explained how there was interruptions during sessions, and I didn't want that to happen. So I wanted a separate space where visitors and clients waiting for sessions could feel comfortable and didn't feel restless. So here's the ideation for this. A lot of this looked like me figuring out different seating areas and just what that would look like to make it more comfortable. And here are those renders of what that looks like. You can see I included a kitchenette for if anyone had food that they wanted to bring, if they were staying for a while. And then also that could be a place for the staff, a sort of break room for them. And now moving on to the larger group studios, I created 3 different group studios because they each have separate purposes. I have a painting, a ceramic, and a craft studio. And I'll give you a closer look into what those look like. So starting off with the painting studio, I made sure in this to ID lots of storage as well as just the specific materials they need and how much lighting would be in this room. And here is what that looks like. I separated the easels and tables in like 3 different sections for if there was multiple groups in that space or if they wanted to be able to move it around, whatever it may be. And also you can see that I included some mats on the ground, and that just helps because it is a concrete floor. It helps with if the floor is cold or if the client is tired of standing, they have a place that is comfortable. And then here's just another view of what the storage looks like. You have all your art materials in the back there, and as well as the canvases and different things like that. And then going on towards the ceramic studio, I wanted to show the room for material storage. I included a room because it was so important to have a lot of storage, and this not only stores the extra materials, but also in use work like paintings and the ceramics that are drying or the client has to come back to, whatever the case may be. And here is a view of the ceramic studio. It's very similar to the painting, but it has pottery wheels and tables for sculpture making. And then as you can see on the back wall there is for like in progress work that's waiting to be glazed or fired. And then here's just another view of what that looks like. You can see there's cleanup area on the back wall, and that's also included in the painting studio as well, so that you could have a place to clean up. And then here is the craft studio. This is just for anything that's not as messy as painting or ceramics, so collage work and collage work, pastels, anything like that. Also included a digital lab for digital art, because I did read that that was also a way that people could express themselves if that was something you're interested in. And now moving on to what that small studio looks like. This is just for one-on-one sessions, as I explained earlier, and this looks really similar to what the large studios look like, just in a smaller form. So it has aspects of each of those studios, and then lots of lighting and privacy for that individual session. And then as you exit all those, you are in the back door seating area, and you have view of all the studios as well as the greenhouse area. And you'll notice that on the walls there's that wood slat walling, and I did that because I wanted to have some sort of privacy in those group studios so that they felt safe and secure and that they could create whatever, but I wanted it to still be slatted so it could have some light come in and still have that natural calming effect. So in conclusion, I hope that my presentation showed you that art therapy is something that's very important. And not only that, but I think a studio is very important. My studio helps show that anyone can be an artist and anyone can feel safe and go into a balanced place to create art. So with that, thank you for listening, and I want to thank Carlos and Gabe and all the ICC staff for however you helped me through this process. And if you have any questions, you can text that number on the screen.
Great, thank you so much, Bree. A couple questions here so far. What led to the inclusion of a greenhouse? The whole building is awesome.
Thank you. Yeah, I included that. When I originally was looking into creating this, I really wanted to have a lot of nature, lots of light. That was like my main goal. And so I wanted to include some sort of greenhouse area, because I was also reading that gardening is a way of art therapy as well, and some art therapists are including that. And so if they wanted to express themselves or work on gardening to help overcome an emotion or trauma, they could do that as well.
Great insight. Question. Which of the spaces would you like to work in, of all the spaces that you created?
That's a good question. Probably it's between the painting and the ceramics. They both look, I don't know, to me they look really cool to look, and especially the ceramics, it's just very bright. And I personally on Cedarville did not take a ceramics class, so I'd love to do that.
What modeling software / rendering software did you use? Your renderings look so good.
I used Revit for both modeling and rendering.
Oh, fantastic. This is from Jim. Well done. Your renders are fantastic. Your hard work really shows. What aspect of the project forced you to grow the most?
Oh, I think it was learning Revit. I had never used Revit before, and so it was a lot of watching a lot of tutorials and just hours of using that to figure out how to create the building that I wanted.
Excellent. And then this is a comment from me, not really a question. just want to commend you for doing a great job of blending a space for art and a space that looks like it belongs at a hospital. And I say that not negatively. It looks like it abides by medical space aesthetics while not looking sterile. And I think that was a difficult balance, but I think you struck that very well.
Thank you.
Let's see, another question. Did you consider accessibility when creating your design?
I did, because I knew that this was something that art therapy is also used for people in that community. And that's why I didn't make it 2 floors. I didn't research too much into accessibility, but I did look somewhat into it.
Excellent. Now I have, I'm going to hand it over to Carlos again, who has some comments and questions. Carlos?
Thank you, Gabe. Bree, first of all, very interesting subject. I think it's very interesting and very good that you were motivated to get into this kind of a project. I have a quick question. Which space of your design would you emphasize, or would you make sure that it has if your project was to become real? Is there any particular space that you would make sure that the realistic project would have?
I mean, the studio part was my main,
Mm-hmm.
Those specific like group studios was my main focus. So it'd probably just be kind of detailing more on those and looking more and researching more into what those could look like, I guess, overall.
Mm-hmm. Mm-hmm. And regarding the concept that you chose, do you think that the concept did make the floor plan more interesting or more in tune with the nature of your project?
Yeah, because I went a lot with that balance idea. All of my rooms kind of balanced around that central lobby, like, and greenhouse space. So I felt like the concept really applied to what I was going for.
Okay. All right. Great. Great job. Thank you. Thank you, Gabe.
Thank you, Carlos.
Mm-hmm.
Bree, well done. Everyone, if you would like to join me in showing appreciation for Bree. Bree did a great job.
Thanks.